Assalamualaikum and Happy New Year to everyone. My name is Muhammad Firdaus. In this video, I want to present about mental health issue. Do you know, as the COVID-19 pandemic continue in Malaysia, mental health issues are taking a growing toll across the country. The level of mental health of Malaysians is now in a worrying state as many suicide cases are increasingly reported in the media. Government statistics show rates of mental health issues have tripled over the past 2 decades. According to the 2019 National Health and Morbidity Survey, roughly 500,000 people in Malaysia reported symptoms of depression. When the pandemic hit, many were impacted psychologically and emotionally. Findings from the local study show that prior to the COVID-19 pandemic, 20% of the people in this country experience symptoms of stress. However, the rate has gone up to 38%. This indicates that the mental health trend of the people is at the worrying level. It is not something that should be taken lightly because stress, if not controlled, can lead to depression, which if left untreated can trigger to suicide. Ministry of Health data show that between January and December 2020, a total of 1,080 attempted suicide cases were reported to have received treatment at MOH hospital, but this figure did not include statistics compiled by the Fire and Rescue Service Department Malaysia. Based on calls received by Fire and Rescue Service Department Malaysia, there was a sharp rise in the number of cases related to attempted suicide in 2020 compared to 6 years ago, which were 253 attempted suicide cases in 2020 compared with 183 cases in 2019 and 170 cases in 2018 and 151 cases in 2017 and 146 cases in 2016 and 141 cases in 2015. So the main factor that contributed to the mental health problem are the financial crisis, job stress, lost job, home confinement and school closure, family and environmental problem, loss of family or parent, unemployment and social isolation have become major driver of anxiety, depression and stress. In Malaysia, addressing mental health will require greater awareness and acceptance, as it is still not widely recognized as important in the same way as physical health. Therefore, there are several solutions that can be done to overcome mental health problems so that they do not continue to get worse. Firstly, education on mental health Education on mental health needs to be the core subject in the school and university to give the knowledge to the younger as well as educate them how to handle it. Besides that, the Ministry of Health and NGO may cooperate to conduct awareness campaign on mental health. The purpose is to give more exposure on mental health among the public. Next, we can make the campaign more effective. To make the campaign more effective, mass media and social media need to be used as well as possible. The awareness campaign can be done by posting the awareness campaign in social media and mass media such as television, Facebook, Instagram, and Twitter. By this way, people also can give support by repost the awareness campaign in their post or story. So as a result, the awareness campaign can be developed holistically in the country. And the last, the government must enhance the access to the mental health service and facility at every level and not just in urban area or certain segment of society. Besides that, the Ministry of Health should increase the number of counselors that provide service on mental health in the city and rural area. So, as a result, the mental health issue will be decreased. That is all from me. Thank you.